In this video, I want to talk about laxatives. So these are drugs that you use to treat constipation. So we have a lot of different laxatives. So I want to put them into three big buckets. The first buckets are luminally active agents. And the idea here is just to put basically stuff into your bowel. So if you're thinking about your bowel, I mean, it's a tube, and the idea would be just to add some stuff to it so that there's a little bit of stretch, and we have the enteric nervous system, so we're going to activate all the stretch receptors and activate the enteric nervous system so that things can move forward and so that a bowel movement can happen. So how can we add stuff into our bowel? Well, one type of drugs within the luminally active agents are so-called bulk forming laxatives. So just indigestible molecules such as psyllium or methyl cellulose. Just adding indigestible molecules to the bowel. Or, and that's the alternative, so these are all luminally active agents, you just use osmotic agents. Some non-absorbable salts, such as magnesium hydroxide, or non-absorbable sugars, such as polyethylene glycol or lactulose. And these osmotic agents are just going to draw water, and that's also going to increase your volume inside the lumen. So that's one strategy. These are fairly well tolerated. You can get some bloating, and please remind your patient to drink lots of fluid because they all depend on water. And that's going to be all added to the lumen. So these are luminally active agents. Then we have a group of drugs that we can summarize under the umbrella term stimulant or irritant laxatives. And they, as the name already implies, they really just irritate enterocytes, make some sort of low-grade inflammation, so more cells are recruited, and there's some stimulation of the enteric nervous system, and also some bowel movements can happen. So just to induce a low-grade inflammation, which also by itself increases fluid secretions, so you're going to have more fluid in your bowel, and eventually a bowel movement can happen. And these are drugs like bisacodyl and picosulfate, very similar. Our famous Dulcolax. And then another drug that fits into this category are the senna preparations, anthraquinone derivatives. Senna is in a lot of these preparations. The only thing about senna maybe to remember is that it can cause some brown pigmentations in the colon. People were always very worried about it. We meanwhile know that it's totally harmless, but it's something you may come across. It has also a name. It's called melanosis coli, and that's what can be induced by senna. Next on the list we have prosecretory laxatives. So in this category is lubiprostone. So you recognize there's a prost in its name, and it's a prostaglandin derivative stimulates another prostaglandin receptor. So the EP4 receptor. So what is that doing? If you're looking at such an epithelial cell in the colon, there are these EP4 receptors here, they get stimulated. So that's lubiprostone. That's the EP4 receptor. And then this is gonna activates the GS coupled receptor, cyclic AMP, and this is going to activate chloride channels like the CFTR. And there's another one, CIC. So different chloride channels. And the idea is you get chloride secreted and then water follows paracellularly. So let's draw in here another one. Chloride is secreted and then a water follows. So you get some secretions, and that's going to help with the bowel movement. And also remember the name lubrication. So that sounds a little bit like increasing water, and that's exactly what you do. And then the prostaglandin reminds you that's a prostaglandin derivative. So this is a lubiprostone. And then there's another one that acts similarly. That's called linaclotide. That's has nothing to do with prostaglandins, but it activates guanylyl cyclase. So it's a guanylyl cyclase activator, guanylyl cyclase. That's linaclotide. And this is going to activate cyclic GMP. And cyclic GMP also activates the CFTR, but not the CIC2. This is this other chloride channel. So we need to take this away. So it's only activating the CFTR, but it really doesn't matter. You get more chloride, you get more water, and that's about it. For linaclotide, you can get some diarrhea, abdominal pain as adverse effects. And because they're so efficient in inducing secretions, you're going to lose so much fluid that they're absolutely contraindicated in infants and children. So there's a black box warning. So not used in children, infants. And just to also finish up lubiprostone, well, it's a prostaglandin derivative, so it's also again contraindicated in pregnancy because it can stimulate uterine smooth muscle, and it can also give you some diarrhea because it stimulates smooth muscle in the gastrointestinal tract. Now we have one more drug for laxatives that we can put under the category of anti-absorptive laxatives. And this is tenapanor, and that's an NHE3 antagonist. And now, if I'm going to draw again such an epithelial cell, maybe this time from the small intestine, because that's where most of the sodium absorption happens. So we have here the NHE3, sodium, in exchange of protons. That's our N, sodium hydrogen exchanger. So it really tells you exactly what it does. It exchanges sodium for hydrogen ions. So if you block this with tenapanor, you're gonna absorb less sodium, and well, if you absorb sodium, water follows. So you're also not gonna have that. So there's less sodium, less water absorbed, and so therefore you're gonna have more in the lumen, and that's called an anti-absorptive laxative, like tenapanor. So you can see why we can put them in a way together, the one inducing more secretions, calling them prosecretory laxatives, the other inhibiting absorptions, in the end all leading to just more water in your bowel, more stuff, more water, leading to some stimulation of the enteric nervous system stretch reflex, having a bowel movement and working as a laxative. With tenapanor, as well as with all the others, as an adverse effect, you can have diarrhea because you're going to have quite a lot of water in your intestines. So just to sum up the laxatives, I just let them on here, the pro-secretory laxatives and the anti-absorptive laxatives. So the one way or the other, just increasing water in your lumen. Then we started with just putting stuff into your lumen, bulk-forming laxatives, or just through osmosis getting more water in there. And this we call the luminally acting agents or laxatives. So this was this category. And then we had this irritant laxatives. And just to throw in a couple of names, so here's our famous bisacodyl and the senna. Here our non-digestible molecules like methyl cellulose, or here our sugars, lactulose, polyethylene glycol, or magnesium hydroxide, or things that are non-absorbable. And then we discuss those types of drugs which have a very specific mechanism of action, meaning acting on the prostaglandin receptor, guanylyl cyclase, or this NHE3. This finishes the video on all the different laxatives to treat constipation.